Now, I've just demonstrated to you that diet plays a crucial role in managing irritable bowel syndrome. In the second part of my presentation, I want to address the which of dietary treatment of IBS with a focus on low FODMAP diets. What do we know about low FODMAP diets? What do we know about the composition of this FODMAP group? What do we know about the effectiveness of low FODMAP diet, which patient groups, effect duration, and what do we know about safety and the effects on the microbiome? Now, with regard to the general approach to patients with IBS, I would like to refer you to this publication, which highlights the importance of lifestyle and dietary modifications in the treatment of IBS. Unknown to many, but very important for you to understand, are the results of this study, which has demonstrated that both dietary interventions and optimized medical treatment reduced the severity of IBS symptoms over the course of a 4-week trial period. However, with a considerably larger effect size of the diet groups, which were the low carbohydrate diet here shown in blue, and the low FODMAP diet here shown in red, as compared to the effects of the optimized medical treatment group. Now let us look in more detail into the FODMAP components of diet. Out of all FODMAP components, fructose oligosaccharides, galacto-oligosaccharides, lactose, fructose, sorbitol, mannitol, lactose contributes the largest part to total FODMAP content, both before diet and during and after diet. A meta-analysis of studies on the effect of low FODMAP diet in IBS has shown an improvement of IBS SSS scores and an improvement of IBS quality of life. However, we have to question whether it is scientifically correct to perform a meta-analysis of FODMAP studies. I want to raise serious doubt about that. First, these were short time studies between 4 days and maximum 3 months in a chronic disease condition. What does this tell us? These were small studies, and these were studies grouped in this meta-analysis with 4 different comparison groups. The green-marked traditional diets, the red-marked typical regional diets, the yellow-marked high FODMAP diet, and here the yellow-marked sham exclusion diet. Furthermore, a careful review of the grade of evidence in FODMAP studies has pointed out that only these 4 out of a total 12 studies on short-term efficacy had a high scientific grade. And regarding long-term efficacy, there are no high-grade studies at all. Low FODMAP, if you choose it, is definitely not a cure for all in IBS. In this study, it has been shown that there is a decreased effect in hypomorphic sucrose isomaltase variants. Low FODMAP diet in non-carriers of this variant had a symptom relief in 61%, whereas in carriers, the likelihood of symptom relief was only 44%. So which are the patients who are most likely to benefit from a low FODMAP diet? To answer this, we have to return to the study on IBS patients with hyperfunctional hypomorphic human carbohydrate active enzymes. The study had a dietary arm and a medication arm with odilonium bromide. And they analyzed genes of a variety of human carbohydrate active enzymes. Response rate to low FODMAP diet is higher in IBS patients with more human carbohydrate active enzyme genes affected. And IBS diarrhea patients who are carriers of hypermorphic enzymes benefit from a low FODMAP diet. Here the benefit in 84% versus in non-carriers, there was a benefit of low FODMAP diet in only 43%. However, they did not benefit from pharmacological treatment. Non-carriers here had a significantly higher benefit likelihood than carriers. Another question which has to be addressed is whether the effect of low FODMAP diet persists after the diet is discontinued. In this study, IBS patients received 4 weeks of treatment with either low FODMAP diet or a prebiotic, and symptoms were analyzed in the 4th week of treatment, which is the black column, and in the 2nd week post-treatment, which is the gray column, and compared to symptoms before diet, which is the white column. This graph here shows that low FODMAP diet reduced symptoms. However, 2 weeks after completing the diet, there was symptom recurrence after discontinuation of low FODMAP diet. Whereas in the prebiotic group, there was a persistent effect, persisting also after discontinuing the prebiotic. This same study has shown a negative effect of the low FODMAP diet on the microbiome as compared to the prebiotic. Low FODMAP diet decreases the abundance of the beneficial bifidobacterium as compared to the prebiotic group and increases abundance of Bilophia vatzwersia, which is considered to be a pathogenic. Indeed, several studies have performed microbiome analysis during low FODMAP diet, and many of these have demonstrated negative effects on the microbiome. Here the studies are shown, and the negative effects in these studies, if they've been shown, are marked in red color. The restriction of food items associated with a low FODMAP diet has been shown to result in decreased intake of a variety of nutrients, be it energy, be it protein, be it electrolytes, or be it vitamins. To summarize, low FODMAP diet has several limitations. It is complex and difficult to teach and learn by the patient. It is difficult to continue and potentially expensive. It reduces natural prebiotics, which may have a negative impact on gut microbiota. It is associated with nutritional inadequacy, hypercaloric diet, low in trace elements and vitamins. It may precipitate eating disorder behavior, and its long-term effects are unclear. It has unproven long-term efficacy and an unknown impact on diseases associated with nutrition low in dietary fibers, like diverticular disease, colonic carcinoma, cardiovascular disease, constipation. Furthermore, there is no effect in other carbohydrate malabsorptions like hypomorphic sucrase isomaltase variants. So let me summarize the which of dietary treatment of IBS and the role of low FODMAP diet. The strengths of low-FODMAP diet may be in the treatment of IBS patients with multiple hypomorphic variants of carbohydrate active enzymes. In these patients, the benefits of low-FODMAP diet may outweigh the limitations and potential side effects. However, long-term efficacy and safety studies are missing. Lactose content plays a decisive role in FODMAP effects. It is a major component of the FODMAP group, and the high worldwide prevalence of lactase deficiency provides a highly relevant source for carbohydrate-related symptoms in IBS in many regions of the world. For more information on carbohydrate intolerances, look at these sources at WUMEDI and on YouTube and Instagram.